chronic pain management. Hey, everyone! Welcome back to my channel. Whether you're dealing with neuropathic pain, musculoskeletal pain, or inflammatory pain, it can be incredibly difficult to manage. But don't worry, in this video, I'm going to share some tips and strategies for managing chronic pain that you can try at home. First, let's talk about the different types of chronic pain and their potential causes. Neuropathic pain, for example, is caused by damage or dysfunction in the nerves, while musculoskeletal pain can be caused by injury, overuse, or age-related wear and tear. Inflammatory pain is caused by inflammation in the body, which can be caused by a variety of factors, including autoimmune disorders or infections. Regardless of the type of chronic pain you're dealing with, there are some general strategies you can use to manage it. For example, exercise and physical therapy can help improve mobility and reduce pain levels. Low-impact exercises like swimming or walking can be particularly helpful for people with chronic pain. Additionally, certain medications like non-steroidal anti-inflammatory drugs, NSAIDs, or opioids can be prescribed by your doctor to manage pain. However, it's important to note that there are potential risks associated with long-term use of certain pain medications, so it's important to work with your healthcare professional to develop an individualized pain management plan. There are also alternative pain management techniques that you may want to explore, such as acupuncture, massage, or herbal remedies. Some people find these techniques to be effective in reducing pain levels and improving overall well-being.